กำแบเข้าออกกำแบเข้าออกกำแบเข้าออกกำแบเข้าออกในทำมังเอกนิ้วชี้กำมังเอกเข้าถ้าออกช้าๆแบกำเต็มที่เอาแบออกโอเคกำเต็มที่เลยกำให้สุดแบออก From at the crease where I would like to do the puncture on the skin subcutaneous tissue along the roof of the flexor fiber sheet. Another finger, middle finger. Usually I will approach at the crease, the distal palmar crease, and then do the injection of the local anesthesia with the 1% silocaine without adrenaline. On the roof of the flexor fiber sheet, where we plan to make a cut proximally and distally. แกะออกจ้ะกำเต็มที่จ้ะกำเต็มที่เลยนะครับแบะออกจ้ะ Okay. From the outer part first and medially to the lateral. For the index, I identify the lesion and the thickness of the pulley and the flexor fiber sheet, and then I put the puncture on the crease where is the imaginary line from the midline of the flexor tendon to cross with the crease, the crease of the palmar crease. I put the puncture with the same line with the crease to penetrate only the skin, and I will rotate a little bit and then push a little force to encounter the flexor fiber sheet first, and then after I touch the sheet, I make a small cut. The cut should be little by little, only using the tip of the instrument. This is the sharp edge of the To control this, I have to make sure that we are on the same plane at the flexor fiber sheet, not deeper than that. And now the patient can flex freely when I have cut the flexor fiber sheet. เอากำเต็มที่จ้ะ flex กำเต็มที่จ้ะโอเคโอเคแบมือจ้ะ
เดี๋ยวนะไปอยู่ฝั่งนี้ได้ไหม
ได้กำมือแบมือจ้ะ You see the patient now can flex freely, but with the cut I use the tip of this instrument. I name it the Blade Probe, Dr. Vijitpornkul Blade Probe.B. B have two sides. This one is the sharpness at the side. I could penetrate this and then rotate and then make the small cut like a superficial sketching with the tip of the finger. That is not too sharp. When I contact the flexor fiber sheet, I use this one for the index. I do a little bit abduction and then make a midline to the crease. Puncture the crease and rotate this, and then feel for the flexor fiber sheet on the midline, and then make the small cut with the tip of the instrument, and then Then I use another one. This is Blade Probe.A. Dr. Vijitpornkul Blade Probe.A. This is two sides. One is the sharp one, but not too sharp. Another one is a blunt one. This one I call it a checker. That means I use it to check for the completeness. Before I complete the procedure, I will use the blunt one to for the blunt one I can make sure that I have the complete cut, because this one I can put in until it reach the tendon surface, and there is some part that's still blocking, so I use the blunt one to have the blunt dissection. 3 tests before the finishing. Palpation with the blunt instrument is the first one. The second one, I use the palpate while am I touching the lesion, and I do the passive movement of that finger. I will feel that no restriction or no obstruction of the movement. The movement is free. And the third test, the patient move by herself. กำมือแบมือจ้ะกำมือแบมือmove by herself นิ้วชี้เข้าออกอย่างสบายเข้าออกอย่างรวดเร็วเลยนิ้วชี้เข้าออกเป็นยังไงบ้างสบายไหมtest by the patient herself that they can move actively. So the 3 tests I make sure that the lesion have been cured. So I have only one small puncture wound. Now okay, the กำแบเข้าออกจ้ะแบเข้าออกกำแบออกจ้ะแบออกyou see I will approach on the usually on the midline of the flexor tendon of the middle finger. I make an imaginary line to cross with the distal palmar crease. That will be the part that I'm going to cut. The middle palmar crease, I will do the puncture first. On the punctures, I have this one for the side cut. So I have an imaginary line on the crease. Put a puncture to control. Only pass through the skin only. And then after that, I rotate to make it in a vertical line parallel with the tendon on the surface of the flexor tendon. I use this one to cut. You see, I'm going to cut the A1 pulley. This is very tight, very thick. The instrument is not too sharp, so it's quite safe. The way I cut, I will penetrate through the flexor fiber sheath, which I feel the resistance, and then cut upwardly with the tip of the instrument. I cut upwardly, so I know this is a layer above the tendon. I never touch the tendon. The tip of the instrument is above the tendon, but beneath the sheath. So I cut the sheath upwardly and on the direction of the midline. กำมือ Now the patient can move freely after I cut. For this one, it's like an initial cut. It's not complete yet. So I use another instrument, the Blade Probe.A, a sharp side to cut, penetrate, and then feel and can feel. I can feel the residual, because this is a sharp cut, a straight one, so it's easier to control the direction. So I use this one. Okay, I cut with this end, and then I check with the blunt one. Okay, กำมือเข้าออก Now the patient will feel free of the fingers movement. เอากำมือเต็มที่แม่จ้ะ 3 tests before stopping the maneuver, the procedure. Use the blunt one to check any retraction. So it's clear. I pull a little bit so that there will be, I will know where the instrument tip is. This is the blunt one. Okay, กำแบเข้าออก Okay, now this is the first instrument test, the passive movement test, and then the active movement by the patient herself. กำมือแบมือจ้ะ กำเต็มที่แบมือกำให้สุดเลยจ้ะแบมือเต็มที่จ้ะกำแบมือเต็มที่จ้ะโอเคครับโอเค so I try to make the cutting near the tendon so to make it safe for the nerve okay like this โอเคกำแบเข้าออกจ้ะโอเคกำแบเข้าออกโอเค so we end the procedure ใครอยู่นะโอเค only the wound only here กำมือแบมือจ้ะกำเต็มที่แบเต็มที่กำแบเต็มที่จ้ะกำแบเต็มที่ I put a few pieces of gauze sterile gauze to put the pressure dressing with the adhesive the way I stop the bleeding by doing the wrist the tourniquet at the wrist levelไปที่นี่ได้ doing the wrist level tourniquet เดี๋ยวนี้เป็นเดี๋ยวถ่ายรูปใส่ก่อนต่อสอบเข้าออกเต็มที่กำแบเข้าออกเต็มที่กำเต็มที่แบกำแบเข้าออกกำแบเข้าออก the movement of the both finger that I have released can move freely immediately กำมือแบมือจ้ะ I put the elastic bandage and keep the hand let the patient keep the hand dry for 1 week to make sure that there will be no puncture no infection through the puncture wound I use this one as a starter I only rotate I only rotate when I touch the flexor fiber sheet I make a little rotate to make the initial cut if I can cut through with this I will do it or else I make an initial cut and I use another one a straight cut this one not too sharp at the one tip I use this one is a direct a straight one so I can control the direction is better and cut with this to make it through after this I use the blunt one to do the to put I can pull along the tendon line to make sure that I have complete cut with the flexor fiber sheet or the A1 pulley. This is a blunt one. It's safe for the tendon. And this is like a navigator to check for the completeness. If there's still obstruction or the movement is not, there's some hindrance. So I will do another cut. I do another cut with the sharp one to have the further cut. Yeah, that's all.